So hi everyone, I'm Michael. I'm founder and CEO of Aimedis. And what we do, I'm a doctor. Aimedis is a medical company, healthcare company, and we build and operate the world's first real healthcare metaverse. Call it Aimedis Avalon. All started with a healthcare platform, a telemedical healthcare platform, which up to now is still running and is combined with what we do now. My background is I'm a doctor, been working in hospitals for a very long time, also in the pharma space. And yeah, I founded Aimedis with my partner, Ben, who is also a doctor. And the idea of Avalon was born because we wanted to create a metaverse space for healthcare. Initial idea was to operate it inside the existing environments like Decentraland or Sandbox, which are great products, but turned out they are not able to handle medical data. They are not HIPAA compliant, not GDPR compliant. They cannot handle medical information and do not support interoperability with healthcare IT, with existing healthcare IT. And so we built this on our own. And what is Avalon? Basically a 3D world built on Unreal Engine that's operating on PCs, Mac, mobile phones, later stage also PlayStation. And it basically shows or contains an entire healthcare and data economy, where on the one side, everyday people, patients, their relatives, people who want to present diseases can interact with the other part, namely the healthcare professionals. That includes hospitals, that includes pharma companies, that includes all the healthcare related businesses like insurance companies, AI companies, therapists, fitness studios, etc., and use their services. And Aimedis is built, or the Avalon Metaverse is built to bring all these stakeholders together and enable them not only to meet each other but to do business, right? Because the metaverse is not about fancy graphics or VR only. It's about economy, right? It's about making and building a business and enabling the participants to build their representations and offer services or use services. A little bit like something like Amazon, of course, not comparable, but the idea is to have this platform to enable others to make business, to offer services, etc. And we have started back in 2021. And what was first an idea became quickly reality. And we said, okay, we need to prove that this is real healthcare. So, all these buzzwords, blockchain and NFTs, which we also have when it comes to data exchange. We can talk about this later if that's interesting. But we said, okay, we have to make real healthcare there from the beginning. So evidence-based healthcare, as we say. And so we started thinking about use cases, and we created the first trial, very small one, but we created a trial with 2 university hospitals. One is in Switzerland, one is in Greece. And we officially treated the first patients in the metaverse. And fun fact, as Ben and I, we are both doctors, as I said, we are co-authors of this trial, which can now be found on PubMed, this platform where all the medical peer-reviewed information is going to, and where others can quote it and can work with it. So it's official. We treated the first patient in the metaverse, and it showed that this is a very good and feasible way of enabling people to get telemedical and general healthcare at home. And when you ask yourself, what is the difference between the existing solutions of normal digital health? The thing is, during COVID, all these solutions climbed or grew a lot, right? Because people were not able to go to an emergency room, they were not able to see their family doctor, and so they use telemedical care. But after that, after COVID is going down and things open up bit by bit, people are less and less using telemedical solutions because they want to have this real contact with doctors. And the metaverse, as easy as it sounds, adds this third dimension to this. So people feel much more involved in what is happening. The immersion is much higher, and you can interact on a completely different level, not only when it comes to talking between avatars and meeting, but especially when it comes to therapies like neurorehabilitative therapies, which is fantastic in VR and in 3D environment. and a real upgrade when you compare it to exercises that are just maybe on YouTube or something. And we see this as a very, very new and very good way of bringing healthcare to people. And as said, we have partnered with big companies, we've partnered with universities, with pharma companies, and are starting to explore how to build out that metaverse solution, right? And it is built in a way that we enable all people and all stakeholders. That also includes other healthcare startups, blockchain companies, whoever is involved in the healthcare space, to come on board and to do their thing, right? To open their business, to open their representation, and perform healthcare in the metaverse. So that is basically what we do. As said, we also offer e-health solutions for hospitals, for patients on the one side, and also we built a healthcare data market which is using NFTs, but that is maybe a little bit too much for now. So thank you very much for listening, and yeah.
That's awesome. In the metaverse, how is the healthcare going to be a little bit different, than, to tell some of the things that you see that people will really utilize in the metaverse they can't do today?
So as said, it is, when you come into this world, you really have to experience it, because talking about it is one thing, but being inside is a completely different thing, because you put on the VR glass and you are there, basically. Let's talk about a very obvious use case. I haven't spoken about that yet. It's the educational and training part. And we are also cooperating with startups in the US and Australia and Europe that bring content to this. When you are in a virtual university lecture, in a university theater, and let's speak about healthcare, or training for doctors, for students, for nurses. When we speak about anatomy, it's much more immersive to experience that in VR and in 3D. So you have a different level of understanding things, right? While being able to interact with all the other people that are there. So it's not just consuming VR content, but really interacting in this VR environment, speaking about business, but also speaking about exchange of information and working together on projects and being incentivized for what you do, right? So there's a big motivation in being incentivized for the things that you perform in a virtual environment, which the metaverse obviously gives you, because it has this economy included in the system. And so as said, the immersiveness is a different one. The way of being incentivized and participated in this Web3 economy, that is what differentiates this system from the normal Web2 solutions.
So the providers be going directly to the patients and getting paid, kind of peer to peer as well? Or would you be building environments where providers could create their own economies inside the metaverse?
Yes. So we offer people and parties and companies and basically everyone the possibility to build healthcare services. That includes a state, that includes training facilities, that includes therapies facilities, that also includes things that we even haven't thought about, maybe because others will do it. So we enable people to realize their dreams and their visions for the healthcare metaverse inside Avalon. And Aimedis has participated with a little percentage and the operations that are happening, but we do not limit this. So this business is only, so we earn money when our participants earn money. So there are no upfront costs involved, basically. There is no, it's a very straightforward solution, we think, to enable people and to give them the possibility to experience and to test things, right? To make experiments and try different things and then find a feasible way of realizing healthcare in the metaverse.